Okay. Thank you. Hello, my name is Elisabeth Hunt, and I am the Program Director of Business Healthcare Technology at Georgia Northwestern. And I'm so pleased to share some things with you about my program so that you can understand some of the options when you try to make your career decisions. One of the key things that we offer in Business Healthcare Technology is education on medical coding. And so I thought I might take a few minutes just to tell you a little bit more about what that entails, what that is, how you would see it in the workplace, how medical coding affects not only billing and reimbursement in healthcare, but the position that it takes on more of a global stage when we try to track diseases around the world. First of all, I just wanted to introduce what it actually is. When we talk about medical coding, we're actually talking about the use of like alphanumeric symbols to identify a disease process, a body system that is affected, maybe causation, why did this disease occur? If it's an accident, we can actually have identifiers that say like where the accident took place. And what's significant about having these specific medical codes is it's not just something that we use in the United States, but we actually use the same codes around the globe. So that connects us with our partners in other countries so that we're tracking not just what's happening in our communities or our country, but around the world. So when we look at the process of getting like a patient diagnosis, of course, a patient diagnosis is made by a physician or a healthcare professional. It cannot be made by us as coders or billing personnel in healthcare. It does have to come from a licensed physician. And what we can do with that is once the physician says, I've designated this as a person with hypertension, then we have computerized programs that help us take that diagnosis of hypertension and put an alphanumeric equation to that so that when we report it out to different agencies within our community or even to insurance companies for reimbursement, we're able to offer the patient a little bit of privacy in that the documents with their demographic information won't show their name and the diagnosis, it shows their name and a code. So we're also hoping to offer one more layer of protection of your healthcare information. Now, the agencies who are going to track this for us more on a global perspective is going to be the CDC, which you probably remember as the Center for Disease Control and Prevention. I know the CDC is in the news a lot lately because of COVID, so we've become more familiar with that. The CDC actually reports the data to the World Health Organization. So you've probably seen some information, again, on the news about World Health Organization and how they work as a collaborative to try to track the diseases where we have the largest outbreaks, where we need the most attention. They also track treatment modalities. We know what is effective and not effective, again, based on medical codes that we're all entering into our systems around the world. So when we think of ourselves maybe behind the desk at a physician's practice or a hospital, inputting all of this information, it may seem like a smaller task in that you're trying to get that entered, to get the billing process completed, to get the reimbursements. But what I always like to tell my students is that the picture is so much bigger. The reason it's so important to get the codes correct is that there is actually an impact well beyond reimbursement, but there's a global impact to it. And that's what makes us better as a world. And I think that's fascinating information. So when we talk about tracking the diseases with medical codes, the way the process works is that within a county, if we look, for example, I'm in Whitfield County today, and so the things that happen in Whitfield County, especially communicable diseases, are reported to our public health department. So the Whitfield County Health Department would get this information. Let's say it's about the number of COVID cases or the number of flu cases. They would get that information and collect it, and on a weekly basis, they're going to report that to the Northwest Georgia Health District. The health district will take that information and translate it to our state agency. The state agencies report it to a country base, such as the CDC. The CDC reports it to the World Health Organization, and they begin to look at all the codes coming their way, not just as Whitfield County, but as Northwest Georgia, the state of Georgia, the United States of America, and then the Americas as a whole. The World Health Organization groups us in with Canada, North America, and South America. We're all looked at as the Americas because we kind of show up that way on a global perspective. I wanted to link over to, I'm not sure if this is going to allow me, but you might be familiar with something called a scatter chart. But when we have an outbreak of flu, for example, sometimes you can log into the CDC or other types of online information sources, and you can see how much flu is in your area by sort of a graph that they depict. You can hover over the graph or the map and know how much flu or how much COVID is actually in your state or in your community. We're seeing that more and more with COVID. I think even the Weather Channel app has a place that you can link into and just see what the disease looks like in your community. That's good for educational purposes, and it's also good when we have to spread our resources out across the state or across the country to make sure that we have enough medical supplies, enough medical staff, enough people working behind the scenes, enough medication, to anticipate the trend that is going on so that within the healthcare community, we're prepared for what is coming our way. You might remember at the beginning of COVID how unprepared many of the communities were, but now that we have the codes to help us track not only the onset of disease, but the progression of disease, and also the codes tell us what treatment modalities are working and are not working. So we find now that we can handle COVID better than we used to because we have the background data given to us by our codes, and that would be something that you would be a part of. The World Health Organization does offer a video link that can tell you more about what they do from place to place. I'm not sure the link is going to play on our PowerPoint presentation, and I apologize for that. But the video did allow you to see the work going on with the global pandemic in countries around the world. The WHO.org is a web link for this site, and there is just tremendous value to the data that you can find, not only about COVID, but probably other things that you are interested in as far as disease progresses and research and treatment that they offer. Now, right now, we are working with a set of codes that we call the ICD10 Codes. These codes began to come into play within the past decade, and prior to that there was the ICD9, and prior to that ICD8, and what they do with each new set of codes is they make improvements. The improvement in coding made by the ICD-10 allowed us not to just look at a simple diagnosis, but to break something down. For example, if we had a child that had a diagnosis of bronchiolitis, that would have been a standard 3-4-digit code in the ICD-9. But in ICD-10, they wanted to know more. They wanted to know if it was a viral bronchiolitis. Is it an RSV bronchiolitis? Is it bronchiolitis by an infection source that's bacterial? And so it became more progressive. So we had more detailed data so that we can make smarter decisions as a medical community. Now, with ICD11, we are going to find out even more data than we're able to capture in the ICD-10. Now, this code is something that is actually a code for a patient who was sucked into a jet engine. And I know that is like such a far-fetched code. Why would you have to have a code for that? But we have it because it happens. We have it because people are sucked into jet engines. So what can we do with this data? Well, we definitely know that they're going to have bodily injury from this. We can track the extent of the injury, but we can also track where this happened. The ICD10 Codes allows us to say this happened at a workplace or it happened in a private setting. It can help us to say, was this person on the job or was this a private citizen? It will track it down to the country where it happened. And so if you have people being sucked into jet engines, we can say most of these incidents are happening in this country at this time of day to personnel who work at airports or private citizens. And so what that allows us to do from a global perspective is work on safety. So we can change some of the things in occupational safety or personal safety to help prevent this from happening in the future. Now, we talked about ICD11. ICD11 goes live in 2022. Now, I expect that the U.S. is going to be a little later in adopting it because we were the last developed country in the world to develop the ICD10. So we may not be quite on target with that. But the goal of ICD11 is to focus on inclusion. There's a thought process behind that the more we understand the individuals in our medical community, the more we can get rid of different stigmas that are attached, and we can take these special populations and we can study their disease processes, their use of medical care, and how it impacts that population, and maybe we can make improvements in the type of care that we give them. One thing that they are focused on is gender incongruence. We're seeing more things with a transgender population. How do we classify those same disease processes in a patient who may be undergoing hormonal transition therapy or different body dysmorphic disorders? So it helps us with this population. Another example is that we're getting things like acupuncture and non-traditional type medicines working in with traditional medicine in the healthcare setting. For example, many hospitals now have acupuncturists who work with labor and delivery patients with pain control or orthopedic patients. So we want to be able to track that non-traditional patient and find out, are we having great success with the acupuncture? Was the process of healing expanded or lessened by using the non-traditional medicine? And again, it makes us stronger as healthcare providers. And then the third picture talks about bacterial resistance to antibiotics. And maybe some of you have heard about the superbugs that we have in healthcare today. These superbugs are no longer responding to the antibiotics that we've used for decades. So now we want to track bacterial resistance. So if we have a patient who maybe was started on an oral antibiotic, maybe they didn't do well, they were admitted and put on an IV antibiotic A, and that didn't work, antibiotic B, that didn't work, antibiotic C, we finally, found something that attacks this germ. So we can track that with codes instead of written research materials through different medical journals. So we think that's going to be more effective in providing a better outcome for our patients. Back to where we were in the beginning with global success, beginning with our first patient encounter. When you work in the healthcare community with this type of degree, you're going to be probably the first and the last person that a patient sees when they enter a physician's practice. And you are going to be responsible for putting in the correct code for their diagnosis and making sure that it meets all the guidelines outlined by the ICD-10 so that we have this good information so that billing is expedited, reimbursement is expedited, but also we become a stronger, healthier community. And that type of tracking is not done by our physicians or our hands-on practitioner. This is done by you in the workplace. And so your ability to do that is so valuable. And the trend in healthcare right now shows that there are plenty of jobs open in this field for people that have experience in this. So I think the employment opportunities are kind of off the chart for you right now. Now, back to the campus at Georgia Northwestern, we offer this type of training in our Business Healthcare Technology program. And we have training that will prepare you to become a nationally certified coder. That means that you could work anywhere across the United States, that you've proven that you have a skill set to do this and to work independently. A lot of our national coders are working from home right now during COVID, and a lot of them will remain working from home. This is a job that you can actually do remotely if that's something that you're interested in. But we offer the training through a certificate, through a diploma, or through an applied associate of science degree. So you have a lot of different options. I like my students to reach their greatest potential, and so we can work with you through advisement to help you find the program that's going to help you reach your maximum potential. We also have a program that's just simply called medical coding. The medical coding certificate doesn't prepare you for the national exam, but maybe you already work in healthcare and you just want to brush up on your skills. That's a 2-semester program. But again, if you want to do the certification exam, I would encourage you to do something different so that you would have all the knowledge that you need to do that. Do we have any questions from anyone attending today? Anything that I can help you with? All right. So, Jason, can I turn it back over to you?
Yeah, thank you so much for that information.
All right.
Let me ask you a quick question, Lisa. Elisabeth, yes. Join us today. Give your email address.
Yes, you can contact me through my work email, and that is ehunt@gntc.edu. I'm happy to give you my office phone number. Some people prefer that, and that is 706-712-0720.
Okay, and I know she would be happy to pass on, if we want to contact her with the information today, follow up through email and stuff like that, and then
Absolutely.
Also recorded this session, and we'll in the works to possibly share this. So just appreciate this information on behalf of Business Healthcare Technology. Like I said, each week we're trying to focus on programs at GNTC, the recruitment office. We're just trying to highlight these wonderful programs that we have. And so if we can help you out, you're welcome to contact Ms. Hunt or contact myself at jgamel, JGAMEL @gntc.edu.
Mm-hmm.
And my contact number is 706-764-3810. And I'd be happy to, correspond with her and get her in touch with you. But each week we want to highlight these programs. There's great information today. I appreciate your time sharing and this information about business healthcare technology. I did see one comment that they really appreciate it and learned, hearing about it today. I told you several questions. If you guys do have any questions, please let us know. And like I said, we'll follow up with you. But thank you so much today on behalf of Business Healthcare Technologies. I'm going to share real quick before we close up. We do have a variety of options at GNTC, and we want to help you the way we can, whether it's yourself or whether it's students or whether it's family that you have that are trying to make decisions about college and about choices, about careers, and we want to help out in the ways we can. So give us a call and give us contact, and we'd like to help you out. Okay? I think this concludes our session today. I'm going to go ahead and stop recording and keep everyone comment.
Okay, thank you.
Yes, thank you, Lisa. Appreciate it, participants, and have a great day.
You too.